Stop sleeping in that position. Seriously, the way you've been sleeping for the past 30 or 40 years might actually be harming your health right now. And here's the frightening part. You won't notice the damage until it's already done. If you're over 60, how you sleep matters more than you ever imagined. This isn't just about comfort anymore. It's about protecting your heart, brain, spine, and even extending your lifespan. A groundbreaking study published in the Journal of Clinical Sleep Medicine tracked over 12,000 adults for nearly 10 years and revealed a shocking discovery. Certain sleeping positions raise the risk of cardiovascular events by as much as 34% in older adults. That's right, 34% just from how they positioned their bodies at night. But it gets even more alarming. Research from Stony Brook University found that sleeping in the wrong position can reduce your brain's ability to clear toxic waste by over 40%. This waste includes amyloid beta proteins, which are directly linked to Alzheimer's disease. So, while you think you're resting, your brain could be slowly accumulating harmful substances. But before you panic, here's the good news. Scientists have identified the sleeping positions that actually protect you, positions that improve circulation, support your spine, and help your brain properly cleanse itself during sleep. Best of all, making these adjustments costs nothing. You don't need special equipment or medication. You just need to know what to do and what to avoid. In this video, I'll guide you through the 4 sleeping positions that people over 60 should stop doing immediately. Oh, more importantly, I'll show you exactly what to do instead. I'll explain the science behind each position, share specific techniques to make these changes comfortable, and present real clinical data so you can see how much difference these simple switches can make. We'll count down from number 4 to number 1, saving the most important position for last because what researchers found about it genuinely surprised me. A 2023 study from Stanford discovered that this single change reduced nighttime oxygen dips by an incredible 61% in seniors with breathing problems. A 61% improvement just from altering your sleeping posture. This dramatic improvement not only helps with breathing, but also reduces the risk of serious complications like heart disease and stroke, which are often exacerbated by poor oxygen levels during sleep. Stick around for that one because it could truly change your life. Let's start with number 4. Before we dive in, tell us your age and where you're watching from in the comments below. We read and respond to every comment, so don't hesitate to share. Now let's begin with position number 4 and work our way up to the most important one. Number 4. Avoid the twisted torso position and try the aligned spine position instead. The twisted torso position is something millions of people do without even realizing it. It happens when your upper body faces one direction while your hips and legs twist the opposite way. Maybe you sleep on your back, but your knees fall to one side, or you lie on your side, but your shoulders rotate toward the ceiling. This creates a corkscrew effect through your entire spine. When you're younger, your spine can handle occasional twisting because your discs are hydrated and flexible, and your muscles recover quickly overnight. But after 60, everything changes. A study published in the Spine Journal examined MRI scans of over 300 adults, aged 60 and older, and found that 72% showed significant disc degeneration in the lower back. When you add rotational stress from sleeping twisted, you accelerate this damage dramatically. The problem with this position is that it creates uneven pressure distribution across your vertebrae, which can worsen spinal degeneration and lead to chronic pain and reduced mobility over time. Additionally, twisted sleeping can compress nerves in the spine, causing symptoms like numbness, tingling, or even sharp pain radiating down the arms or legs. This not only disrupts sleep quality, but may also increase the risk of falls and injuries during the day due to impaired nerve function. Another overlooked effect is that twisting the torso during sleep can affect your internal organs, potentially leading to digestive issues or reduced blood flow to vital areas. To counteract this, experts recommend focusing on maintaining a neutral spine alignment where your head, shoulders, hips, and legs are stacked in a straight line. Using supportive pillows can help achieve this alignment, such as placing a pillow between the knees when sleeping on your side or under the knees if you sleep on your back. These simple adjustments reduce unnecessary spinal rotation, allowing discs to recover and muscles to relax properly. Over time, adopting the aligned spine position can significantly improve sleep quality, reduce chronic pain, and enhance overall mobility, enabling you to enjoy a more active and fulfilling life well into your later years. Your facet joints, although small in size, are incredibly important as the crucial connectors between each vertebra in your spine, playing a fundamental role in maintaining both spinal stability and flexibility throughout a wide range of movements. These joints allow your spine to twist, bend, and extend while maintaining structural integrity. However, when the spine undergoes twisting motions, the facet joints experience a biomechanical imbalance characterized by compression forces on one side of the joint and stretching forces on the opposite side. This uneven mechanical stress leads to gradual wear and tear of the joint cartilage, inflammation of the surrounding tissues, and eventual stiffness and pain. Over time, frequent or habitual twisted postures, whether during daily activities or sleep, can exacerbate this imbalance, increasing the risk of chronic lower back pain that often prompts individuals to seek medical evaluation, physical therapy, or other interventions to manage discomfort and regain function. For example, research conducted by Johns Hopkins University has established a clear link between habitual twisted sleep postures and the development of musculoskeletal problems. Their study found that adults who consistently sleep in twisted positions are approximately 2.3 times more likely to experience prolonged morning back stiffness lasting over 30 minutes compared to those who maintain neutral spinal alignment during sleep. Beyond the effects on the musculoskeletal system, twisting the spine also has repercussions on internal organ function. Specifically, the compression of internal organs such as the stomach and intestines during twisted postures can interfere with normal digestive processes, leading to symptoms like acid reflux, bloating, and indigestion. These gastrointestinal symptoms are often mistakenly attributed solely to dietary factors, but the mechanical compression and altered positioning of the organs play a significant role. Supporting this, a study published in the American Journal of Gastroenterology reported that seniors who habitually sleep in twisted positions experienced 47% more episodes of nighttime heartburn compared to those maintaining proper spinal alignment, underscoring the importance of correct sleep posture not only for spinal health, but also for maintaining optimal gastrointestinal function. To prevent these issues, it is essential to maintain an aligned spine during sleep, ensuring that the shoulders, spine, and hips all face the same direction to minimize twisting forces. One effective method is to lie on your side with a supportive pillow placed between the knees, which helps keep the hips aligned and prevents rotation or twisting of the lower spine. Additionally, using a body pillow or a rolled blanket positioned behind your back can help maintain this alignment throughout the night, while also serving the added benefit of reducing snoring by keeping the airways open and unobstructed. Mattress choice plays a critical role as well. A medium-firm mattress that supports the natural curves of the body, evenly distributes weight, and alleviates pressure points can substantially reduce pain and improve sleep quality. For instance, a study from Oklahoma State University demonstrated a 48% reduction in back pain after just 4 weeks of sleeping on a medium-firm mattress. Furthermore, selecting a contoured pillow that supports the natural curvature of the neck reduces cervical strain and the incidence of morning headaches, which are often caused by inadequate neck support during sleep. It is also important to avoid sleeping with your arms overhead, as this position compresses the nerves and blood vessels in the shoulder region, particularly in individuals over the age of 60. This compression increases the risk of thoracic outlet syndrome and nerve impingement, conditions that can cause numbness, tingling, and weakness in the hands and arms. A study conducted by the Cleveland Clinic found that 63% of seniors who reported hand numbness were sleeping with their arms overhead, and notably 71% of these individuals experienced symptom improvement after switching to a position with their arms down. Additionally, sleeping with arms overhead places stress on the rotator cuff tendons, which naturally lose elasticity with age, making them more susceptible to injury. The Journal of Shoulder and Elbow Surgery reported that 40% of adults aged 60 to 80 had some degree of rotator cuff damage, often without noticeable symptoms, highlighting the importance of preventive measures such as proper sleep positioning. Therefore, sleeping with your arms alongside your body or supported on a pillow not only helps preserve shoulder health, but also reduces discomfort and prevents nerve compression, contributing significantly to improved overall sleep quality. Taken together, these factors demonstrate the critical importance of maintaining proper sleep posture, not only for our musculoskeletal health and pain prevention, but also for supporting the function of vital internal organs and enhancing general well-being over the long term. Adopting the arms down position while sleeping requires mindful practice and gradual habituation, as it may initially feel unfamiliar or uncomfortable, especially if you have long been accustomed to sleeping with your arms elevated, crossed over the chest, or tucked under pillows. This transition is not merely a matter of shifting limb placement, but involves retraining both your body and subconscious sleep habits which have likely been ingrained over many years or even decades, making the change psychologically and physically challenging. To begin this process effectively, start by consciously keeping your arms relaxed at your sides or lightly resting on your chest and abdomen, ensuring your elbows remain below shoulder level throughout the entire night to maintain optimal alignment. This specific positioning is crucial because it promotes proper blood circulation by preventing compression of blood vessels and nerves that might otherwise occur if the arms are raised or bent awkwardly, which can lead to numbness, tingling, or even pain that disrupts restful sleep and cause frequent awakenings. By maintaining the arms down, you significantly reduce strain on the shoulder joints and surrounding muscles, which can help alleviate chronic shoulder pain, reduce stiffness upon waking, and prevent the development of conditions such as thoracic outlet syndrome, nerve impingements, or rotator cuff issues, ultimately contributing to improved musculoskeletal health. These benefits extend beyond physical comfort, potentially improving sleep quality by minimizing nocturnal awakenings caused by discomfort and allowing deeper, more restorative sleep cycles. To help maintain this posture comfortably throughout the night, it is often helpful to place a small pillow or a rolled towel under each arm for gentle support, thereby preventing your arms from drifting upward or inward unconsciously during sleep. Alternatively, using a full-length body pillow can be especially effective in keeping your arms at a natural height and providing a physical barrier against unwanted arm movement, creating a cozy and stable sleeping environment that gently encourages proper limb placement without restricting freedom of movement. Alongside these physical supports, incorporating gentle shoulder stretches such as shoulder rolls, cross-body stretches, and doorway stretches into your bedtime routine can be highly beneficial in relaxing the muscles and promoting flexibility. These stretches help release built-up tension in the shoulder girdle, increase overall flexibility, and promote relaxation of muscles, which collectively make it easier to maintain the desired arms down position throughout the night by reducing muscle tightness and discomfort. Importantly, scientific studies have shown that performing evening shoulder stretches can reduce the frequency of nighttime arm repositioning by approximately 38%, indicating a significant improvement in sleep posture stability and comfort, which in turn supports sustained adherence to this healthier habit. Beyond arm positioning, it is also recommended to favor sleeping on your left side rather than your right side, particularly if you are over the age of 60 or have existing heart conditions such as hypertension or congestive heart failure. This recommendation is grounded in extensive anatomical and physiological evidence. Since the heart lies slightly to the left of the center of the chest, sleeping on the right side shifts the heart's position and increases its workload by about 8%, a change that can place additional strain on aging or weakened hearts over time, potentially exacerbating cardiovascular issues and increasing the risk of adverse events. Supporting this, research has linked right-side sleeping to a 23% increase in hospitalizations among patients with heart failure, underscoring its clinical significance and the importance of mindful sleep positioning in managing chronic health conditions effectively. Additionally, right-side sleeping adversely affects digestive health by impeding stomach emptying and increasing the frequency of acid reflux episodes by nearly 40%, whereas sleeping on the left side facilitates better digestion and lymphatic drainage by optimizing anatomical alignment and allowing gravity to assist in the efficient movement of digestive fluids through the gastrointestinal tract. To successfully transition to this healthier sleep pattern, practical measures include placing a body pillow behind your back to prevent rolling onto the right side during sleep, sewing a tennis ball or similar object into the back of your sleepwear as a tactile reminder to maintain left side positioning, and elevating your head slightly using a pillow or wedge to reduce neck strain and minimize acid reflux symptoms. Through these combined adjustments, mindful arm positioning, supportive physical aids, targeted stretching routines, and side sleeping strategies, you can achieve improved sleep quality, better cardiovascular support, enhanced digestive function, and overall well-being that positively impacts daily energy levels, mood, and long-term health outcomes, making this approach a comprehensive and sustainable method for optimizing nightly rest. Research published in the American Journal of Gastroenterology has provided compelling evidence that sleeping on your left side with your head elevated approximately 30 degrees can significantly reduce nighttime acid reflux by as much as 90%, which greatly improves comfort during sleep and reduces the need for medications commonly used to manage gastroesophageal reflux disease, GERD. This position takes advantage of gravity to keep stomach acid from flowing back into the esophagus, thereby minimizing discomfort and preventing damage to the esophageal lining, which can lead to complications such as esophagitis, Barrett's esophagus, and even esophageal cancer if left untreated over time. In addition to this, placing a supportive pillow between your knees while lying on your left side helps to properly align the hips and pelvis, which not only supports the heart-healthy posture but also enhances overall spinal alignment and reduces strain on muscles and joints throughout the lower back and legs. This alignment promotes better circulation throughout the body and lowers pressure on vital organs such as the heart, lungs, and kidneys, contributing to improved cardiovascular health and overall bodily function. Improved circulation also aids in reducing swelling and inflammation in the extremities, which can be particularly beneficial for individuals with conditions such as varicose veins or peripheral edema. Equally important is the advice to avoid lying flat on your back, particularly for individuals over the age of 60. In this position, gravity causes the tongue and surrounding soft tissues to fall backward, obstructing the airway and significantly increasing the risk of obstructive sleep apnea, OSA, a condition characterized by repeated pauses in breathing during sleep that can last from a few seconds to over a minute. A landmark study conducted by the American Academy of Sleep Medicine revealed that adults over 60 experience a 33% greater incidence of airway collapse when lying flat, which results in fragmented and poor quality sleep, leading to excessive daytime sleepiness, irritability, and impaired cognitive function. This disrupted sleep pattern is associated with a range of serious health complications, including chronic fatigue, increased risk of hypertension, stroke, type 2 diabetes, and cardiovascular problems. The New England Journal of Medicine further underscored the severity of untreated sleep apnea by reporting that it quadruples the risk of cardiovascular mortality, highlighting the critical importance of managing this sleep disorder effectively through lifestyle modifications, positional therapy, or medical interventions such as continuous positive airway pressure, CPAP. Elevating the head between 20 and 30 degrees has been shown to reduce episodes of oxygen desaturation by an impressive 61%, thereby improving oxygen levels during sleep, enhancing overall sleep quality and boosting daytime alertness, particularly in seniors age 65 and older, who are more susceptible to hypoxia-related complications. Moreover, sleeping flat not only exacerbates acid reflux symptoms by doubling their frequency at night, but also elevates the risk of developing esophageal cancer due to chronic irritation and inflammation of the esophageal tissue. Brain health is also adversely affected by sleeping flat, as this position reduces the efficiency of the brain's lymphatic system, the network responsible for clearing metabolic waste products, by approximately 40%. This reduction in waste clearance allows harmful proteins such as beta-amyloid and tau to accumulate, which are closely linked to the development and progression of Alzheimer's disease and other forms of dementia. Therefore, raising the upper body by 20 to 30 degrees while sleeping helps keep the airways open, facilitates proper stomach drainage, and supports more effective brain detoxification processes. This can be achieved using specialized wedge pillows designed to maintain a gentle incline or through adjustable beds that allow precise control over sleeping angles, both of which are widely available and can be tailored to individual comfort preferences. Combining left-side sleeping with head elevation provides the maximum therapeutic benefit by addressing multiple health concerns simultaneously, including enhanced respiratory function, reduced acid reflux, improved spinal health, and optimized brain waste clearance. These relatively simple modifications to sleep posture can markedly enhance overall sleep quality, reduce the risk of serious and potentially life-threatening health issues, and significantly improve quality of life, especially for older adults who are particularly vulnerable to the complications associated with poor sleep posture and obstructive sleep apnea. By adopting these evidence-based sleep habits, individuals can promote better heart health, improve respiratory function, protect brain health, and enjoy more restorative, uninterrupted sleep throughout their later years, ultimately supporting longevity and healthier aging. Ensure that your entire upper body, from your hips upward, is fully supported on an incline rather than just propping your head up with extra pillows, which creates a chin-to-chest angle that can actually worsen breathing and lead to neck pain, muscle strain, and stiffness upon waking. The ideal solution is an adjustable bed frame, which allows precise control over the elevation of both the head and foot sections, enabling you to find a comfortable and effective angle that promotes optimal airflow and spinal alignment. Research from the National Sleep Foundation revealed that 78% of individuals using adjustable beds reported better sleep quality, with the average user raising their head by about 22 degrees, right within the optimal range that reduces acid reflux symptoms and improves breathing patterns. For the greatest benefits, try combining this elevated position with sleeping on your left side, which means lying on your left side with your upper body elevated at a gentle incline. This position offers the cardiovascular advantages of left-side sleeping, such as improved heart function and circulation, alongside the airway and acid reflux improvements that come from elevation. A study published in Sleep Medicine compared various sleeping positions and found that seniors with sleep-related breathing problems experienced the best overall outcomes when sleeping elevated on their left side, including reduced apnea episodes and less nighttime discomfort. If you cannot invest in an adjustable bed or a wedge pillow, you can still create a similar incline by placing firm pillows or even a foam pool noodle under the mattress at the head of your bed to gently raise it. The crucial point is to create a gentle slope rather than a steep angle, which can cause sliding or discomfort and negate benefits. Some individuals even use bricks or risers under the legs at the head of the bed frame to achieve a subtle whole-body incline, which can be surprisingly effective and cost-efficient. When starting out, elevate gradually if the feeling is uncomfortable. Begin with a 15-degree incline for about a week. Then, increase to 20 or 25 degrees as your body adjusts, which usually takes about 2 weeks of consistent practice. To recap the key points discussed today, position number 4 involves avoiding a twisted torso and instead maintaining an aligned spine with shoulders, spine, and hips facing the same direction to prevent disc damage, reduce morning stiffness, and minimize muscular imbalances. Use a pillow between your knees to support proper spinal curves and reduce strain on the lower back. Position number 3 is about keeping your arms down at your sides or resting on your chest instead of overhead, which protects your rotator cuff tendons from impingement and prevents nerve compression that causes numbness, tingling, or pain. Small pillows can help create comfortable resting spots for your arms, promoting relaxation and better circulation. Position number 2 advises sleeping on your left side rather than your right, which enhances heart efficiency, improves digestion by facilitating gastric emptying, and decreases acid reflux by up to 40%. Body pillows can help prevent rolling over to the right side at night, maintaining this beneficial posture. The most important change, position number 1, is to avoid sleeping flat on your back and instead elevate your upper body between 20 and 30 degrees. This simple adjustment has been shown in studies to reduce harmful oxygen drops by 61%, protect your heart from strain, aid in more effective clearance of brain toxins through improved lymphatic flow, and significantly, lessen reflux symptoms that disrupt sleep quality. Best of all, these changes are free to implement, require no medication, and have no side effects, yet they can substantially lower your risk of heart disease, cognitive decline, chronic pain, and sleep-disordered breathing conditions such as obstructive sleep apnea. I challenge you to select just one of these position changes tonight and stick with it for 2 weeks before trying another, allowing your body time to adapt and for you to notice improvements in comfort and restfulness. Within 2 months, you can dramatically improve your sleep quality and safeguard your long-term health, enhancing your daily energy levels and overall well-being. Remember, your body repairs itself during sleep. Your brain consolidates memories crucial for learning and emotional health, and your heart receives its only true rest of the day. Don't let something as simple as your sleeping position undermine these vital restorative processes. If you found this advice helpful, please share it with someone over 60 whom you care about, as they may not realize how profoundly a simple adjustment can impact their health, potentially reducing the need for medications or interventions. And as always, consult your doctor before making any significant changes if you have existing health conditions, particularly respiratory or cardiac issues. Sleep well and sleep smart. Why? But you might hide. Your future self will thank you for making a positive change today. I'd love to hear from you. What sleeping position have you been using for years that you now realize could be causing you discomfort or even health issues? Share your story in the comments below and let me know if you're ready to try something new and potentially transformative tonight. We also want to hear if you or someone you know has persistent trouble finding a truly comfortable sleeping position. What specific problems or pains have you noticed from sleeping in the wrong way? Please share your personal experiences and thoughtful insights with us in the comments. We truly enjoy reading and learning from them. Thanks so much for watching and being part of this community. And Ashkat's commute.